Welcome to the Besties with Breasties podcast. Sarah Hall here. I am a certified health and wellness coach, athletic trainer, mom, and breast cancer survivor. I help women overcome their own mind drama to make mind shifts that open up the possibility for their most empowered and energetic life.
And I am Beth Wilmus, author, speaker, and founder of a human investment organization, otherwise known as a nonprofit, called Faith Through Fire. Our mission is to reduce the fear and anxiety that breast cancer patients feel and replace it with hope and a path toward thriving.
This podcast is about our experiences with breast cancer
and life after as young survivors and moms.
Hola!
Is it hola or hola?
I'd like to say ho.
Yeah, I was going to say, you're offending all of our Hispanic or our Spanish-speaking
Yes.
Sorry.
No, I was calling you a ho and saying la at the same time.
Oh, it's
Hola.
like that. It's like that.
It's like that.
It's like that. I must have done something.
No, it's a term of endearment when I call you a ho. Use a hoe.
Use a hoe. Oh my gosh. This is not PG. Usually we keep it PG.
I know. It's because we're recording in the afternoon and we usually record in the morning. So usually we're kind of like a little bit calmer. But today it's like nice weather and like it's
we're
the
squirrely.
afternoon.
We're squirrely because we're in an enclosed studio and we're like itching to get outside.
Yeah, totally.
So we're going to talk about genetic testing today, which we've had a lot of people that wanted us to talk about it. So did you have any genetic testing done when you...
I did.
Okay.
Right when I was diagnosed. I think it was like one of the very first things that I did. Mm-hmm. Was BRCA testing. And I remember I got the choice between like the full panel and then like just the 9 or something.
Mm-hmm. What'd you do? I mean, I would assume you went full.
Gosh, I have no idea. Probably the full.
I mean, you're not like a halfway person.
No.
You're not going to be like, oh yeah, leave off like 10 mark.
Yeah, I think I did the full.
Yeah.
I'm pretty sure.
I did the BRCA testing too. I think it's pretty standard. Once you get diagnosed with breast cancer, they...
Yeah.
Almost, I think they always do it because they want to know if you're at high risk. So I did that and then I did the breast cancer index test. We're going to talk about today the mental health implications of doing these tests.
Yep. And then we're going to talk about what the different tests are so that when they're offered to you or when you learn about them.
Or if you learn about them, yeah. And then some of the pros and cons of this testing because I think that's a really interesting thing to talk about.
It is. It seems like a black and white decision, but not always.
Mm-mm.
But before we do that, let's hear from our first sponsor. Thrivent is a proud sponsor of Faith Through Fire. Thrivent believes money is a tool and not a goal. The Gateway Financial Group with Thrivent is local to the St. Louis area and can work with you to create a financial strategy that reflects your priorities and helps you protect the things that matter to you, like family and giving back. Please call 314-783-4214 to schedule a free consultation with one of Thrivent's Gateway Financial Advisors.
All right, and we're back. So, Sarah, how do you feel about genetic tests that tell you if you're predisposed to something? Like, not even breast cancer.
Ooh.
Like, now they've got tests, for Alzheimer's and Parkinson's and breast cancer.
Well, okay, so here's what I think about genes in general is that I think genes... What is that analogy where, like, genes load the gun and the environment and lifestyle pull the trigger?
Right.
Okay, so that's the analogy, and that's how I think about it, which means that plays into how I think about these things, and it is something to think about if it's something that's in your family. Like we have a little bit of Alzheimer's, which I have a hard time saying Alzheimer's in our family, and I think if there was a test that's going to say definitively yes or no whether I'm going to have it, but I wouldn't trust that definitively yes or no I would have it because, like I just said, it's my lifestyle that would implicate whether I would get it. So I don't
sort of. There's like with some of these mutations, it's a mutation, right?
Totally.
So it's not lifestyle definitely plays a part. My thing is like, okay, let's say you take a test and it says that you're predisposed to Alzheimer's.
Yeah, but what's the percentage of predisposition? Because like even with BRCA, I mean, I think BRCA, the stats are pretty high, right?
Yeah, it's like 90% chance you're going to get breast cancer or ovarian cancer that's why women are like proactively.
But like there's a reason why they ask you within every single appointment, like, do you have heart disease in your family or do you have blood pressure, like any kind of blood pressure issues in your family? And it's like, my family is riddled with blood pressure issues. Me, not at all.
Yeah. I mean, most breast cancers are not genetic.
No. Not these days.
Most breast cancers are not genetic. If most breast cancers aren't genetic, that means they're environmental, correct? What other alternative is there?
Yeah.
If they're not genetic,
They have to be.
They have to be environmental.
Environmental and I feel like you have to play with lifestyle.
Because same thing.
Environmental, yes, the things that are around you, but you could live in like the middle of a farm and eat pesticide free and yada, yada, yada. But if you put crap on your skin and eat crap, then
I know, but there's so many women that we know that don't eat that way, that are very holistically minded, that have been doing all the quote unquote right things, and they still get breast cancer. I feel like we veered off. Like, I feel like we veered off. I feel like we need to go back in terms of like knowing. Here's my concern with these tests is what it does to your mental health.
Yeah,
that's the concern I have.
Totally.
Can you do anything about it? You're gonna say yes.
I just think this decision is not black and white.
It's definitely not black and white. I just think it's a slippery slope. It's like as we keep advancing medically and you can go in and just analyze your whole genome. Mm-hmm. I mean, it could be terrifying. Mm-hmm. I mean, everybody has the propensity for cancer. It's literally a matter of if your cells divide and you don't repair it, which is what some of these tests do. So let's talk about that. Like the BRCA gene and the CHEK2 gene. If you have a significant history of breast cancer in your family, a lot of times these mutations are the culprit. So basically, they make you way more susceptible to getting breast cancer and other cancers. So these are both blood tests. But basically, they use DNA to identify harmful changes or mutations in these genes. And anybody that has these mutations is at an increased risk.
And it's and usually it's like all female cancers, right?
I think for BRCA, it's mostly ovarian and breast cancer, but like the CHEK2 gene could be multiple cancers.
Oh, interesting.
I believe. CHEK2 is kind of a newer test. Like I only recently started hearing more and more women say, can you do a podcast on CHEK2 because I have that gene? Like, it feels like a more recent thing.
Yeah.
The CHEK2 is a tumor suppressing gene. So it basically protects cells from being cancerous. So basically, like, if your cells divide, then if you don't have these mutations, then your body can repair itself. But if you have a problem with one of these genes, it might not be able to do that.
Oh, interesting.
And so that's what causes cancer to grow out of control is if you have this mutation, you can't repair yourself like other people can.
Gotcha.
And that's why I'm saying, like, I don't know that environment's going to help you on that front. I don't know.
Yeah.
Maybe it does. I don't know. Nobody's talking about it.
Yeah.
That's probably.
We don't know. We have no answer.
No. But I mean, most people who carry a mutation in CHEK2 have one normal copy of the gene and one mutated copy. So because kids inherit one copy of each gene from each of their parents, you have a 50% chance of passing it on to your kids. And I actually have a friend, and she and her sister are both positive for CHEK2. Her sister's already had multiple cancers. I think she had a preventative double mastectomy, and I'm sure my friend's thinking in the back of her mind, like, am I going to have to do something preventative?
Oh, gosh, that's just like such a terrible way. Like when you're, anybody in your family that you're close with, like you have to start thinking about that pretty early on in life. It's such a huge decision.
Oh, I know.
Yeah.
Well, so recently my sister-in-law, because we have a lot of breast cancer on my husband's side, and my mother-in-law family has a lot of breast cancer. And so my sister-in-law recently texted and said, hey, I think everybody should get tested for BRCA and these genetic mutations. She's like, mine came back fine. And my husband's like, should I get tested? And I'm like, yeah, I think you get tested. And
well, yeah, but what if his mom got tested, then he wouldn't have to get tested?
I don't think she did.
If she would just get tested, then no one else would have to get tested.
I think
if you go to the top,
I think to convince her to test is going to be the problem. That would be my guess.
Yeah. I mean, maybe she's on this black and white. She just doesn't.
Her sister died of breast cancer, and her other sister had breast cancer.
Yeah. So I can imagine that there's a pretty big fear factor just to get tested.
I mean, a lot of people feel that way. A lot of people would rather not know. And that goes back to my previous point about the slippery slope. Like, do you want to live with the knowledge? Because let me tell you, if I had my girls tested, if I tested negative.
Yeah. Same.
But let's just say that, I don't know, I was positive or whatever. If I had my girls tested and they're positive, and I know this when they're like 15, 16 years, I hate the idea of knowing that information.
Yep.
It feels icky.
Yeah.
I don't have.
Yeah, but it might help you in like in our last episode, just like controlling the things that you can control.
I know. And so a lot of women, you can either be hypervigilant.
Yeah.
Like if you know you're positive for these genes, you can be hypervigilant. You can get mammograms every 6 months.
Right.
You can get MRIs. You can do all these things to try to catch it as early as possible. Or I'll never forget the person that reached out to me when I got diagnosed was kind of more of an acquaintance. We didn't know each other well. Our moms knew each other, but she had a preventative double mastectomy because she had the BRCA gene, and every woman in her family had gotten breast cancer.
Yeah.
And she had just been through it so much. And she was just like, nope, I'm not dealing with this BS. Yep. And she just had a preventative. And we actually have somebody else that we know, Casey, that had a preventative because she was very susceptible to getting breast cancer. So women are choosing to do this more and more. It's just the idea of knowing that information makes me sad.
Yeah.
And I wonder how that feels, you know?
Yeah, for sure. Yeah.
All right. Well, before we kind of go into some additional tests that exist out there and the implications with that, you want to do Boobs in the News?
Let's do it.
All right. Boobs in the News is a fun segment where we read funny tweets by real people or ridiculous news stories.
Boobs in the News, Boobs in the News, Boobs in the News.
All right. This says, embarrassing dad mistakes daughter's bra cups for snack bowls.
Wow, were they hard?
No. And that's what makes it funny. Look at this picture.
Oh my gosh.
See that?
I mean, I guess, yeah, sure. You could use like a little paper towel. You could use like a little, oh my gosh, those inserts.
They're like the bathing suit inserts, you know? And so anyway, it says one dad has gone viral on TikTok for cluelessly mistaking his daughter's padded bra inserts for food bowls and filling them with snacks. And on the video, people, he's got two very frothy drinks with like her cups full of pretzels. It says in the 6-second clip, which has been viewed over 1.3 million times, user Emily Vogel shows herself looking mortified as she realizes her dad did not grab the intended snack bowls when setting the table.
Where were they that he thought they were snack bowls?
I mean,
did he go to the laundry looking for a snack bowl?
She said, my dad found my bathing suit pads drying and thought they were little snack bowls.
Oh, man, that's cute.
I mean... I feel like men that are surrounded by women at home, it's just like, you poor
hilarious.
Souls. You're so... And so it like literally this dude's a boob.
Totally.
It totally fits. Has your dad ever my dad grew up in a house full of women. I only have a sister. So it was my mom, me, and my sister. There was a lot of estrogen going on. I'm trying to think if I ever had like an embarrassing run-in with my dad regarding like female stuff.
No, my dad, I think, just avoided all that.
That's what I was going to say.
Conversation, everything. Yeah, no.
Yeah, no, there was no conversations. Like, he didn't do the laundry.
Yeah.
There were no discussions about growing up or changing. Yeah. Like, there was none of that. Yeah, I think avoidance was the name of the game there.
That's pretty funny.
Yeah, there's your boobs.
Boobs in the News, Boobs in the News, Boobs in the News.
We're back. All right. So I talked about taking the BCI test. Did you take the breast cancer index test?
No idea what that is.
Okay. So unlike BRCA and the CHEK2, which are blood tests, this test takes a piece of your tumor and it tells you if you're likely to benefit for more hormone therapy.
So typically this is something that's done like after, 5 years down the road after your tumor's been taken out.
Yes.
Yeah.
Okay. So you would be getting this test now. If you
want it was offered to me.
Okay.
Twice.
Yeah.
Yeah.
So when I was approaching year 5 with hormone therapy, I was getting so excited about quitting. Like I was like, yes, I'm coming up
jumping ship.
I mean, I was so meticulous about taking the pill every single day. I never missed a dose. I mean, I was so compliant. It was insane. I had extras in the car in case I went somewhere and forgot. I mean, I was just the most compliant patient ever. But when I got near that 5-year mark, I mean, within the last 3 weeks, I was finding it so hard to swallow those last, that last prescription.
Like, what's the point of 3 more weeks?
Well, I was so excited to quit. And then as I was approaching 5 years, my oncologist was like, I think you should do 10. And I was like, no.
Yeah,
Nope. I don't want I don't want any of that. So she said, well, why don't we do the breast cancer index test and see if you'd be benefit? And I will be honest with you, my mind was made up.
Yeah.
It did not matter to me.
Point. Yeah.
I agreed to do the breast cancer index test, but I already said in my mind, like, I don't care what this test says. I'm not doing it.
Yep.
It came back. She said, it's not likely to benefit you to have another 5 years, which if I was wanting to look into that more, maybe that's bad news from their perspective. But for me, I was thrilled to death.
Wait, why would that be bad news?
Because hormone therapy only works for like 50% of women anyway. And I'm just wondering if maybe I wasn't the person.
So you took it for 5 years and it really did nothing?
No, I mean, there's a 50% chance it wasn't going to prevent a recurrence anyway. But I'm just saying, like, maybe, like, if you're likely to benefit, it keeps your cancer away. Whereas some women, it doesn't do anything for them.
Yeah.
So maybe the point was like, man, we don't really feel like this was going to do much for you anyway.
So I feel like I was kind of in the same boat. Like, I knew I was going to come off of mine. And so it was offered to me then as well. Like, she actually just offered it to me back when I saw her in December, which was just a couple months ago. And I was like, I mean, I don't know that it would really matter. And this was the exact conversation that I had, is that, like, I don't know that it would really matter if it said that I was going to benefit or not. Like, this is what I'm doing.
Yeah.
So.
And you have to, like, everything with these medicines is a percentage.
Yeah.
So it's like, you know, if you're only going to benefit 2% for 5 years of your life, like, for me, I'm like, that ain't worth it. You know, I mean, everybody's percentages are different. Everybody's threshold for tolerance is different. But this breast cancer index reports 2 different results: how likely the cancer is to come back 5 to 10 years after diagnosis, and if you're likely to benefit from taking hormone therapy for a total of 10 years. All she told me was you're not likely to benefit from an additional 5 years. She did not tell me how likely it is to come back in 5 to 10 years. And I didn't ask, and I don't care. And that goes back to our previous conversation about how much do you want to know? Yeah. She could tell me I have a 90% chance of it coming back, and I don't want to live like that. I'm not going to live like that. Yeah. So that's information, and I credit her. She didn't offer up that percentage, and I'm glad. I don't want to know it.
Because you kind of live into it. Once somebody has given you the news, you live into it, regardless of, like, how you live your life anyway.
What does that mean?
Meaning, like, if somebody was to tell you you have 6 months left to live, well, then sure, you've made up your mind. That's how much time you have left to live, because that's what somebody told you.
Right. Yeah.
But if somebody,
prophecy.
self-fulfilling prophecy. But if somebody was like, if in their mind they thought you had 3 months left to live, and they're like, you could live a long, healthy life, then great. Then you're going to live like you have a long, healthy life.
So I was doing research for another podcast episode, and gosh, I wish I had it in front of me so that I could be 100% accurate. But the short story was that there was a man in the 70s whose doctor told him that he had advanced stage cancer and he had 6 months left to live. The man
spent all his money.
The man, like, to the nose, like, on the 6th month, the man died. They found out in the autopsy he did not have cancer.
What?
Yeah. Yeah.
Oh.
So it's like the they call it the anti-placebo effect.
Yeah.
So it's like, obviously the placebo effect, right? Like,
obviously.
people think they've got benefit when they're taking sugar pills, right?
Yeah.
Like, the mind is that powerful.
Totally.
Placebo,
I 100%
yeah,
believe
doctors will admit that the placebo effect is a real thing.
Yeah.
Anti-placebo is the same thing. This man thought he was dying. He died, and he had no cancer. Yeah. And that's happened more than once when people are misdiagnosed and die because of their perception that they're dying. So, all that to say,
wow.
Yeah. Yeah.
Wow.
So here's the thing with the breast cancer index. If you want to take it, because some people are data people, and that's how they like to make their decisions, and that makes them feel comfortable, which we 100% support. Sarah and I are not by any means like telling you what to do. But the eligibility for that is if you were diagnosed with early stage, like I think 1 to 3 breast cancer, your cancer is hormone receptive positive, there was no cancer in your lymph nodes, or it was in like 1 to 3 lymph nodes, and you've been taking hormone therapy for like 4 or 5 years, and you want to know, if you're likely to benefit. So that's, I did do the test, but I had my mind made up pretty much from the get-go.
Totally. Yep.
So the one that we talked briefly in our previous podcast with Jamie was the Guardian Reveal test, which...
The Reveal test.
Oh, gosh. I have very mixed feelings about this test based on my interactions with patients. It's So this is a blood test that detects circulating tumor DNA in early stage, like colorectal, breast, and lung cancer. So basically, so here's how it worked for Jamie. Jamie took the test, and it said that there was no residual disease in her blood.
Right.
Which is what you want to hear.
Yep.
That worked out okay for Jamie, right? I had another patient who had done everything the doctors told her to do. Double mastectomy, chemo, radiation, all the drug therapy. And for whatever reason, and that sounds a little judgy, I don't mean it, but it's like she took this test.
Yeah.
And it came back positive that she has residual disease in her blood. What can she do about it?
Right.
So she really regrets getting it.
So she's spiraled, probably thinking she's going to be metastatic. Like,
it's going to come back. I'm going to die from this. It's going to be metastatic. It's going to be horrible. Blah 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 blah. I mean, because she has circulating DNA. So
wait, what was she early stage or?
Yeah.
Yeah. Wow. Yeah. I could see how that could spiral you.
Yeah. And so she actually was being very vocal to other people, like, just think about it before you do it. Because
so what did they tell her to do?
Well, that's kind of the problem with the medical community is then all of a sudden you're told, well, you're under surveillance.
And so you're just sent out into the world on your own with that knowledge.
Now, to your point, like you're always like, well, what about lifestyle changes? What about environmental changes? Yeah. That's when I would get super laser focused on that if you hadn't before. Mm-hmm. But you're still living with the knowledge
that it's in you.
And
you're kind of doing those things out of fear instead of out of just a desire to be healthy.
Right.
Yeah.
Which
is not a good driving force.
I don't think it's good. Now,
wow.
Now, when you do it like in Jamie's situation and other patients, they're trying to decide, do I need chemo?
Yeah.
Do I need radiation?
And I could see the benefit for it. Like I feel like when I was diagnosed, it was kind of, although I've been told now I was treated really aggressively, but now a lot of people who are stage 1 cancer is kind of either on the table or off, or chemo is now either on the table or off the table. And I feel like it would be potentially could be a valuable test if you are one of those people who is like on the fence about chemo, kind of like Jamie was. Well, she wasn't on the fence. She knew she didn't want to do it. But if you're on the fence about doing chemo or even your doctor is on the fence about whether you would qualify as stage 1 for doing chemo, it might be potentially
But then you
useful
do it. Okay, so it comes back positive. You do chemo. You take the test 6 months later. It's positive again.
Yeah. I mean, but that's kind of like, that's any kind of medical intervention.
That's what I'm saying. Like, call it emotional avoidance, but I'd be like, nope.
Yeah.
Nope.
I agree. It would be very specific, the situation that I would think would.
This is how our metastatic friends feel. Like, our metastatic friends have been told that they have incurable breast cancer. And they're just always waiting for the shoe to drop.
Yeah.
This is the PTSD that they live with.
Yeah.
And now you're introducing it to people who haven't...
Early stage.
Yeah, well, you're introducing it to the general population, to the people that haven't recurred yet. So now you're just spreading the mental angst to everybody.
Yeah.
I don't know. I have weird feelings about this.
I'm surprised this test isn't something that they're offering to just anybody.
They're probably going to get to that point.
Yeah.
I know one of the hospitals is now, they're really touting it. They're really marketing it like it's a cancer, like, screening. Like, you can get screened now for lung cancer, like, super early. Like, it's a blood test. Or there's, like, another one where you can, like, basically say, oh, we caught it so early. And the idea is that you catch it so early, you can treat it so early.
Yeah.
Which feels a little bit different.
Yeah.
That feels different than you've been diagnosed and now you're trying to figure out how to live your life.
Yeah. I guess, is this test, is it specific to, you said colorectal, breast, and lung cancer?
For this one, I believe so, yeah.
Okay, gotcha.
I think they think there could be implications
so
for
I would
others.
be curious if they would offer that to, say I was a female and I went in there and had this done, how would you know which it is?
Well, I think they're doing it.
Then you'd be like, no. Now go get a...
They're doing it for people who have already been diagnosed.
Right. Well, I'm saying if this comes out as something that they would offer for preventative care.
Well, they do have other blood tests that are doing that already. It's just not this one.
Oh, gotcha. Okay.
But then again, it's like, okay, so you caught my lung cancer so early that there's no tumor. What are you going to do about it?
Right. Yeah. Yeah.
What are you doing about it?
No.
I don't think our medical community is equipped to answer that.
No, I don't think so.
So why are we doing tests that we can't, like, you give somebody this devastating news and then be like, well, we're just going to surveillance you until it shows up and then we'll do what we always did.
Yeah.
How does that make sense?
This feels like preventative care. That's
mentally like
a mind trip.
Causing mental angst.
Yeah.
I don't know.
Yeah.
I don't know. So if you test positive for an inherited genetic mutation, here's the thing. So your test comes up positive. You're BRCA positive. You're CHEK2. You could feel anxious. angry, sad, depressed. I mean,
overwhelmed.
We've talked to patients who are like, I did it because I was told to do it, but I didn't think, or I wasn't counseled about how I'd feel when I got the news.
Yep.
So there is something called genetic counseling, and theoretically you're supposed to get counseling that kind of says, this is what it is. This is how you might feel if you hear this answer, and kind of prepare you, but that doesn't always happen.
Right.
So some people do not get tested for genetic mutations because they have concerns over insurance discrimination.
Mm-hmm.
We actually have a member who, that was her. She highly suspected that she had the BRCA gene just due to her family history.
Yep.
But she and her husband didn't want to get denied life insurance, and she was very young. So they said, well, we'll just put off the BRCA test until after we get insured.
Yeah.
The following year, she was diagnosed with breast cancer. Shortly thereafter, she got stage 4 diagnosis.
Yeah.
So this is all things that happen every day. Strained family relationships, like, if...
just talk about your family now.
Well, that's what I'm saying. Like, if my mother-in-law does not want to know...
Now you guys all have to get tested.
And we all... But we get tested and we find out that we have it.
Yeah.
You know what I mean? Like, some people might resent that you've now kind of forced them to know.
Kind of opened that can of worms,
Mm-hmm.
yeah. Yep.
Yeah, so it can strain relationships depending on how everybody feels about it. You have to make difficult decisions about preventative measures.
Mm-hmm.
I mean, women are having their breasts removed.
Yep.
You know, without any sign of cancer.
Yeah.
The feeling of inevitability that like that you'll get cancer, which is kind of what we talked about.
Yep.
I mean, obviously, there's help me with the positives on this, Sarah.
Well, like in Jamie's situation, it was positive for her because it gave her a little bit of relief when it came back negative.
Right. She didn't have to do chemotherapy.
She knew she had confirmed cancer. And when she couldn't do the drugs physically because she had such a bad reaction, like having stage 1, again, like I was talking about, having that stage 1 where she was trying to decide, is cancer going to save my life, or is it preventative, or, what's going to happen here? And when they said negative on her reveal test, like, okay, great. Well, now I get to move forward with that confidence.
And I mean, it can feel good. Like, so preventative measures, it is extreme, right? To amputate body parts and to have your ovaries removed and things like that. However, it can also be empowering.
Yeah.
Like, I'm going to make this choice so that I can lead a full life and not have to worry about this hanging over my head.
And, also there are the people out there who would have like the feelings of anxiety, depression, overwhelm if they didn't have the test.
Just thinking that it could be there and just
like if you have this family history and you don't have a test, like if you don't do that reveal or you don't get your genes, like if you have a 50-50 chance of getting it, like there are some people who are like, I don't want to know. And then there are some people who are like, the unknown is freaking terrifying.
But here's the thing.
They go get tested and, maybe they do come back positive, but they're like, now I know. And
but here's the other side of this. There's a lot of uncertainty or concern that your result may not be a true negative result because, like, there are families that have cancer just everywhere. Everybody in their family has gotten cancer or died from cancer. They go get genetic testing and they say, oh, you don't have a gene that we know of. Well, it doesn't change the fact that there's probably a genetic component there
that they don't know.
That they don't know about. They just haven't discovered. So. For sure. I don't know. We did this episode because we had a lot of Check 2 women that wanted to kind of talk about what it's like.
And I don't think we've talked about gene testing at all. So
I don't know that we have.
No. I mean, we might have mentioned that we both got it and we were both negative. But
I think it belongs in quality of life, don't you?
I do. Yeah. I think that it's a big question mark in some families and some, situations, and people want to know about it.
Yeah.
Yeah.
All right. Before we kind of talk about what we want people to take away from this, let's hear from our last sponsor. It's important to have a primary care doctor that you can count on. At BJC Healthcare, world-class and compassionate primary care providers are ready to see you at offices close to home. And you can count on BJC to make it easy with convenient online scheduling, virtual visits, and direct messaging. To find a BJC primary care provider near you and to schedule an appointment online, visit bjc.org/primary care. All right, we're back. Here's what I think people listening should really contemplate. If you're going to do these tests, don't just a lot of times doctors will kind of say it like very flippantly, like, oh, we'll just order this test and we'll see what it says and then we'll make a decision from there. Give yourself the space to think about how you'll respond
with either result.
Yeah. Exactly. Because I don't know that we give ourselves that emotional bandwidth to really think about, if it comes back positive, how will I feel about it? How will I live my life? And if it comes back negative, same thing. I just think you have to know yourself, because everybody's different.
Yeah, for sure.
And so it always goes back to this. You know yourself best. And so, but don't rush into those tests, without giving it some thought, because it
does sound very like when they presented in the office, at least this is what it was like for me, that it's just like, oh, we'll just do gene testing. And it's like, okay. And then you just kind of like glaze over it.
Mm-hmm.
But I think it is worthy of taking a pause and thinking about that.
Yeah. And counseling about what those results could mean for your quality of life or your future is not often given. It's kind of like just offered like, oh, this will help inform our next move. But there's not a lot of time where somebody's like, let me have you sit down with somebody who can really explain to you what this might mean for you.
Right.
And you are well within your rights to ask for that before you do any tests.
Yeah.
All right. Until next time, guys.
See ya.
Thank you for being a listener of the Besties with Breasties podcast. If this podcast had a positive impact on your journey, leave us a review or consider becoming a supporter. You can donate with the link in the show notes or at faiththroughfire.org. This episode was hosted by Sarah Hall and Beth Wilmus, audio and production edits by Innovative Frequencies.